Greetings and welcome. My name is Jane Barton, and it is my delight to be here representing the Society of Certified Senior Advisors. In this module, we're going to talk about home and community-based services, and I will use the abbreviation HCBS just to save time, and it is kind of a tongue twister from time to time. In this module, we're going to talk about, again, how we as CSAs can ensure that our seniors remain independent as long as possible, where they can choose a place to age that is appropriate for them and of their own choosing, and how to leverage the resources that are available in your specific communities. Now, as typical, I love to tell stories, so I'll start this module off with another story as well. This comes from the time that I served as a hospice chaplain, and I was serving a couple that was in our care, and the wife of this particular couple was the actual hospice patient. When I met them, they had recently transferred into a nursing home, and they had been moved into a small one-room, two-bed part of the operation. And the gentleman, I realized when I met them, was very high-functioning. Although he was in his mid-80s, he was a delightful gentleman and had very few disabilities associated with his admittance into the nursing home. And when I asked them about their decision to do this, he shared with me that his wife, who had ALS and was now confined to a bed, was the love of his life, and there was no way that he was going to remain in their home and allow her to transfer into a nursing home by herself. So they had sold their house and they had both moved into this facility. Now, let me say that this facility was lovely. The staff was very attentive and they were getting a high quality of care. But they were, in their discussion, I could tell, heartbroken that they had had to leave their home of 40 years. The other part of the equation is when I talked to them, I realized that the wife was incredibly guilty that her husband was no longer able to live where he wanted to be, in their home. And they talked about all the things they missed. They particularly loved to garden, and when I met them, it was in the spring in Denver. And this is when they had enjoyed their house the most, when they could sit out on their back porch and they could truly reap the fruits of all their labor from the last 40 years, and they could see all the perennials blooming, and they could enjoy the birds that came to their bird feeder. Now, these are the simple things in life, and they are the sacred things, and these are the things they missed the most. And in relationship to the topic, the home and community-based services, I realized that they were not aware of many services they could have availed themselves of that would have allowed them to stay in their home a little bit longer. Now, even if it were just for a short period of time, 2, 3, maybe 4 months, those would have been precious times for them. So as a CSA, the message is know the services that are available in your community that will allow your seniors to remain as independent as possible for as long as possible. And you are going to serve as that repository of information. You're going to be the guide. You're going to be the mentor for the seniors that you serve. So the great news about HCBS, that it's available to people of all ages. It's not just relegated for seniors, but if you have a disability, if you have a need, HCBS organizations can come to your home and provide a level of care that is appropriate for you. It also allows the person to, again, experience that level of independence that they so desperately want. The other great thing about HCBS services is they coordinate the care in conjunction and in collaboration with the existing informal support of a person. So let's say you are 70 years old and you're married, and you have adult children that live in the same town. That's your informal community of care. And so that family is helping you along the way, but you need additional help. An HCBS organization comes in, they assess the needs that are there. They also assess the resources that currently are available. And you come up with a plan of care that leverages the abilities of all involved. So it is a wonderful collaborative discussion to identify the needs and the wants of a person and work to achieve common goals. Now, the availability of these different services will vary based on where you live. Obviously, if you live in a large metroplex like I do in Denver, Colorado, you probably have more community services available than if you lived in a small town in West Texas. Again, you as a CSA, wherever you practice your particular business, it's important for you to understand what services can you refer your clients to. Now, the number one fear that most people have, at least we're talking in Western society now, as we age, is our loss of independence. This is definitely a Western attitude. Independent living, though, is not just doing things by yourself. It's being in control of how things are done. So it's not that I can do everything up until the point that I die. I realize I'm going to have limitations. But if I have a voice in that, if I can have a discussion around it, if I feel part of that conversation, that is incredibly important. And that's important to all the seniors that you serve. They need to feel as if they are being heard. That is incredibly important. And as I served in hospice and palliative care as a chaplain, oftentimes that's a reflection I would receive back from the people that I journeyed with. They would say, "Thank you so much for listening." Now, I know in our textbook for CSAs, over and over again, it says that one of our greatest challenges as a CSA and one of our greatest opportunities is to listen. And that certainly comes into play when we were talking about how we can help our seniors remain independent by bringing services that they need into their own home. Now, HCBS is provided through two models of care. The first model is the medical model. This means that the providers that come into your home are under the supervision of a nurse and or a physician. And oftentimes this care is paid for by insurance, Medicare, or Medicaid. Sometimes you will hear this referred to as skilled care. Now, another model of care for HCBS would be personal or consumer-directed models. This means the provider comes into your home, and oftentimes they're directed by the family or the patient themselves. They are not under the supervision of a nurse or a physician. And many times this type of care will be paid for through private pay, so out-of-pocket expenses. Now, there's some federal programs that we're going to review, and we're going to talk about how they influence and sometimes fund the available HCBS programs in your area. So the Older Americans Act, the White House New Freedom Initiative, and Medicaid waivers are things you need to be very well familiar with because these are things you're going to refer your clients to. They are incredibly beneficial, and again, depending on where you live, you need to determine exactly what programs are available in your community. So let's look at the Older Americans Act. It began in 1965 and it established the National Aging Network, which is headed by the Administration on Aging, sometimes referred to as the AOA. Now, I would imagine that if you are in the field of senior services, you are familiar with this terminology. If not, you're going to be familiar after the end of this module because I'm going to say it quite often. This also established 655 area agencies on aging for people 60 years and older. Now, in my particular vernacular, we refer to this as the AAA, and it's oftentimes affiliated with a particular county. So a lot of different verbiage to remember, but administration on aging, very important. And area agencies on aging, they will serve you and your clients incredibly well. We're going to outline exactly what it is they can offer you. Now, the AOA has a website, as do most organizations these days. I invite you to explore this website and also to share this with your clients. A wealth of information. It will identify programs and opportunities and services you might never have imagined were available. So check this particular website out. Also, the AOA sponsors a website called the eldercarelocator.com. This is an important tool for you and your clients to use as well. Let's say you're curious about the area agency on aging, your local chapter, but you don't know how to access it. You don't know their phone number, you don't know their specific website address. This is how you can find it. You can put in a search engine, you can use the name of your town, you can put in a zip code, but it will give you that specific information for the AAA in your particular community. It's a great starting point, and I would also encourage you to do some networking with the people that work at your local AAA because that can be a wonderful referral source and also a research source for you as well. They have a lot of knowledge, they have a lot of interaction with organizations all over your particular area. Now this is my reminder to tell you about a handout that's also available online. You can download it. The title is Administration on Aging Programs. I feel like Vanna White today, giving you a little summary here. But the Area Agency on Aging, they do a variety of programs and they provide resources on all aspects of aging. I'm not going to read through this litany of different things, but I encourage you, download this, print it off, and I would put this in a readily accessible place. This is a cheat sheet that you will probably refer to quite often, and certainly feel free to print this off and share it with your clients as well. Now, the White House New Freedom Initiative, this was established in 2001 to promote community living for the disabled population. Now, this is for any age, but it's important to recognize that it is available, it exists, and it also helps many people to have access to assistive devices, some higher forms of technology that will allow them to live with a higher quality of life. Now, Medicaid waivers are becoming more and more important as we see ever-increasing costs in health care. Now, what basically Medicare waivers recognize is that if we can provide care in someone's home, it is much more cost-effective than transferring someone and relocating them to a nursing facility. So basically, the care that you need is being delivered to your home through a Medicare waiver. Now, what we've recognized over the last 20 or 30 years through a lot of research and also just common experience, we recognize that 90% of people want to be cared for in their home. That's where they want to stay. And actually, that is where most people say they would choose to die. The reality is that 75% of us will receive care and die in an institution, typically a hospital. So we want to change that. We want to change the reality such that it matches what we want and where we choose to be, and that is in our home. Medicaid waivers can facilitate that process. The Department of Health and Human Services controls access through Medicaid. Now, what you also need to be aware of, and we always talk about pre-planning, being anticipatory in what is going to come in the next 6 months to a year, this requires some patience, and oftentimes there is a waiting list, again, dependent on where you live in the country. So if you see a need that might possibly precipitate this application, be sure to encourage your client to do this sooner rather than later, because it's not going to happen tomorrow. It may be 3 to 6 months down the road. Now, technology and disability. Technology is fabulous, isn't it? And I'm so outdated all the time. That's why I have a lot of young friends. They kind of keep me up and running on different things, and when I need to reset my phone, I hand it to them and they help me. Well, that's a luxury. But for those of us who have a disability, technology is not a luxury, it's a necessity, and allows us to live and maintain our independence quite often. For Americans without a disability, technology makes things easier. It's a convenience. For Americans with disabilities, technology makes things possible. So what I encourage CSAs to do, I want you to check out either online or if you have a store in your community, become very familiar with some of the adaptive devices that are available for seniors or for those with disabilities. There are several stores here in Denver that specialize in this. And from time to time, I will swing by and just talk to the staff there and ask them to update me on certain devices that are new advents in how we can help those with disabilities be independent and to live a high quality of life. It is amazing what is available out there. And I work in the healthcare field. So if it's amazing to me, imagine if you are serving a senior that knows very little about healthcare other than their specific needs. Again, you can serve as an educator, you can be a teacher, you can guide them to resources that will enhance their quality of life. There's some other things that you need to be aware of, a responsibility as far as being a CSA. Network like crazy and know some fabulous people in your community that can connect you to the resources your seniors need. I have a certain skill set. You have a certain skill set, but none of us is capable of doing everything. That is the beauty of collaboration. That's the beauty of referral. So you need to have a great Rolodex, or you need to have your file on your iPhone or on your computer. You need to know what people do extraordinarily well, and you will refer to them without hesitation. What a benefit for you, and also what a benefit for your clients. And if you do that well, you don't have to worry about marketing. The word will spread that you are adept at your job. You also need to be very well connected with the area agencies on aging. Again, have a contact there. I much prefer to refer somebody to an organization when I can say, oh, I know Betty Smith. I have worked with her on several projects. Here is her direct phone number, and tell her I sent you, and she will serve you well. It makes a difference. People don't want to call in and use the automated phone lines and have to punch a bunch of buttons before they can talk to a person that they never heard of. Relationships, as we've talked about before, are critically important to the seniors that we serve. They do business based on trust and based on relationship. So this feeds into that whole dynamic. Also, if you weren't aware of it, United Way has a 211 service, which allows you to call in. It's multilingual, which is very nice and certainly appropriate in our very diverse culture. But this is an opportunity to access some other resources in the community and ask some questions as well. If you've never called into 211, I would invite you to do that. Again, become well educated on what this would offer your seniors at an appropriate time.